Welcome to OMD Educate. Today we'll be focusing on mental health. My name is Katie Peter and I'll be taking you through this demonstration. During today's demonstration, I will be using TELUS PS Suite EMR. I'll be using a test environment, so no patient health information will be shared. Mental illness indirectly affects all Canadians at some point in time through a family member, friend, or colleague. Mental illness affects people of all ages, education, income levels, and culture. We will be reviewing common tools used for scoring and facilitate diagnosing patients with mental illness. Let's begin. You can run a search on this patient population. These searches can be customized to look for and to show criteria in which you would find helpful for patient care. The way to keep these patients properly identified is with coding and standardized methods of data entry. If you're interested more on this, there is an OMD Educates video on coding. As you find these patients within your report, you're able to see the criteria in which you've deemed to be important for patient care within this search criteria. Once you find these patients, you can open up their record from here. Once the record is opened, you will see that there is a toolbar that presents the PHQ-9 as well as the last date and score here. You also will see that a reminder is present. This toolbar and this reminder have been activated by the problem list stating depression. These tools are there to be able to assist in going through and entering in the PHQ-9 as well as the relevant information. The PHQ-9 can be performed by a healthcare provider asking the patient questions. The patient can also complete the form. This PHQ-9 button has been linked to show red when a PHQ-9 is due to be completed. This PHQ-9 form in which we click on to complete has also been set up to lock the patient's record so that a patient can go ahead and complete the PHQ-9 prior to the physician or clinician entering the room. This locks the chart so that when they are done completing this information, it will actually log you out of the TELUS environment, assuring that patient health information has not been able to be accessed. By clicking done, it will simply log you out of the EMR. Once the clinician opens up the patient record, they will notice that the toolbar has turned from red to green, indicating that the patient has completed a PHQ-9 as of recently. It will also represent the data in which the PHQ-9 is presenting within the record. The provider or clinician would also recognize that the reminder for the completion of the PHQ-9 is now gone. These are also available to be customized for the time frame in which you feel would be necessary for your patient set or patient population. In a patient record, we have the availability to be able to look at the PHQ-9 in a couple of different ways. One way that you may find useful to look at a PHQ-9 and relevant treatment is to graph the PHQ-9. You simply would click on the patient record using the shortcut of Control-G to open up the graphing and using the standard nomenclature of the custom vital that you wish to be graphing. In this case, it is at PHQ-9 : We would then click OK. When we do this, it would show us the PHQ-9 scores for our patient. Now say that we had a treatment that we performed. Maybe we gave them a new medication. We would be able to look at the point in time when we changed the patient's medication and then also look at their PHQ-9 scores against that. Thank you for joining the OMD Educate session on mental health. We have more sessions available on our website. If you have interest, please feel free to log on and join. If you require further support for tools, or maybe a hands-on session with one of our peer leaders or advisors, we're here and we're happy to help. We look forward to connecting with you again soon.